Hello and welcome to JA Explained. This is an episode all about juvenile arthritis pain and how you as a caregiver or parent can help your child or loved one better manage it. I'm Corrine Pinter. I am an active volunteer at the Arthritis Foundation. I have a daughter, Emily, who is 15, who is diagnosed at 2 with polyarticular arthritis, and she currently has psoriatic arthritis. So I understand how distressing it can be to watch your child struggle in pain and feel like there's nothing you can do to help. Our guest today, Dr. Cara Hoffart, will share advice on how we as caregivers can help our loved ones live better with pain so that we in turn can all breathe a little easier. Dr. Hoffart is a pediatric rheumatologist and director and founder of the Rehabilitation for the Amplified Pain Syndrome RAPS program at Children's Mercy Hospital in Kansas City. It is one of only a handful of pediatric pain rehabilitation programs in the country and helps children with chronic pain redeem their lives through functional approach. Additionally, Dr. Hoffart serves as director of the Pain Management Clinic at Children's Mercy and is an associate professor of pediatrics at the University of Missouri, Kansas City School of Medicine. Dr. Hoffart, welcome.
Thank you for having me.
What are different ways pain can show up in children with arthritis? Like, I know there's different types of pain, so can you go over those with us?
So there are different types of pain. Not all pain is the same. So when you have pain because of active arthritis and inflammation, that's inflammatory pain, where your immune system is revved up and bringing a lot of different immune system players to the site of the joint, and that can cause a lot of pain. And so that's inflammatory pain. And then there's nociceptive pain, the fancy word for that, meaning if you put your hand on a hot stove or you sit on a thumbtack. So those things that are meant to cause pain, they're supposed to be painful. And both nociceptive pain with heat and sharp objects or this inflammatory pain, those are meant to be protective types of pain. So those are the types of pain that say, alert, alert, something's wrong. You should take it easy. Go see a doctor. You need medicine. Don't run a marathon on your sprained ankle. So you're supposed to have that pain so that way you can care for your body. But then there's another type of pain that doesn't serve that same purpose. So there is another type of pain, which is kind of considered a dysfunctional pain, or the term for that is a nociplastic pain is the fancy word. And so nociplastic pain is where your nerves are sending pain signals and it's very real, but they're not supposed to be doing that. And so they can basically send pain signals when they're not supposed to, and your brain can start to interpret regular sensations like even touch or pressure as pain because the nerves are basically on a loop of pain when they're not supposed to. So if you sprain your ankle and you treat that, or you have active arthritis and you get put on medication to control your arthritis and your arthritis is under control, well, now that you've healed your sprained ankle or your arthritis is under control, your pain signaling should stop because that the source is gone, you're better. But some people actually get a short circuit in that pain signaling. And because of the short circuit, some people's nerves basically don't get the memo that they're better and they get on a loop of pain. And once your nerves get on that loop of pain, the easier they fire, the bigger they fire, the stronger they fire. So now the pain continues, even though the underlying trigger is better, and there's not actually maybe even active disease there anymore, but the nerves don't know that. And now it can even get to the place where the pain nerves become so powerful that they'll even start to notice, even start to tell the brain that touch is painful, or a hug is painful. And so then the pendulum just swings too far with the pain signaling. So those are basically the different types of pain. And so it's important to work with your rheumatologist to figure out which type of pain your child is experiencing, because you need to know if there's an ongoing underlying trigger like active arthritis, because if there is, you need to treat that. And maybe once you treat that, then the pain will improve or mostly resolve. But if you treat it and there's not active arthritis, then there might be more of that dysfunctional or nociplastic pain, or we also call it amplified pain.
And I think that's what, and I hear, and I've heard personally, and I've seen myself personally, is that you hear that, oh, well, my daughter's conditions, her arthritis is under control, she looks great. And then it's like, why does she still hurt? So that's a good explanation of, we do have pain that's supposed to be there. We do have pain that shouldn't be there. And this is a good question. How can I tell which type of pain my child has and what are the best treatments for each option?
Yes. So I think we don't expect parents and families to figure it out all by themselves. And I just want to acknowledge kind of that statement you made about, well, you look fine, and you know how frustrating that can feel to a family
Yeah,
and especially to a patient.
yeah,
To hear like everything looks fine, because sometimes what that ends up doing is making it feel like it's all in their head or it's not
mhm,
real.
yeah,
And so I think understanding that pain is frustrating because you can't see it. It's invisible disease in its own right. And sometimes, obviously, when you have active arthritis, you can find swelling and there's warmth and there are some more physical changes. But when you have pain left over, that's a nerve issue. It's a nerve processing problem. Your brain isn't processing those pain signals correctly anymore. It just says everything is pain, pain, pain.
mhm,
And so you can't see that. And that feels really, really frustrating. And both arthritis and chronic pain conditions can really feel like invisible disease, and people just don't understand it. They don't get it. I think one, as far as figuring out the types of pain, is one, was there an injury? Was there, a trauma of some sort to explain it? Is this a new pain? So did you sprain your ankle? Is there a clear mechanism of injury? So that's that kind of acute nociceptive pain. So figuring that part out. If there's no injury and you have history of arthritis, is this your arthritis? And so on exam, oftentimes we can feel warmth at the joint. There can be swelling at the joint. And so there might be limited movement at the joint. So there are things that we can find on exam. But interestingly, even chronic pain conditions, because of the way that the nerves and the blood vessels work together, you can get a cold joint, you can get a hot joint, you can get a
mhm,
swollen joint just from pain alone. So not even just always with arthritis. So that's where it gets a little more confusing and muddy. Um, but with active inflammation with arthritis, I think rheumatologists, we touch a lot of joints. We tend to know if there's arthritis, we can typically feel that. But we also know our exams aren't perfect, and there's data to support that. And so when it's relatively obvious, then we can work on that and treat that. Um, but sometimes there are really subtle inflammatory changes that we can't feel on exam, and if there's a lingering question that is keeping people from being able to move forward with treatment options one way or the other, sometimes you have to resort to imaging to
mhm,
really know if there's still arthritis. But if there's no active arthritis and the arthritis is quiet and under control, then that means there's leftover nerve pain from that arthritis. And especially patients who have underlying chronic disease that cause pain, like arthritis, they might have an easier setup to develop a chronic pain syndrome on top of that. But approaching nerve pain is very different than approaching inflammation or an injury.